Last year's Gastein Forum laid down the challenge that we needed to have a new big conversation about health. We've spent the last 12 months talking and the last few days exploring the role of innovation and how it can make our health systems more resilient.
Issue are that public health services, who are more a kind of common good, should be financed via taxpayers' money, so from all of us, because it's of use and good for all of us too.
First time we are pooling together to fight against cross-border health threats. Or, for instance, something completely innovative, the joint procurement of vaccines, which I hope will take place voluntarily through the signing of agreements between most member states later this year. So there are several means of getting people together, getting ideas together, and in spite of the strong dimension of subsidiarity on health matters, we still try to coordinate and give some value added to our actions as well from the centre.
One thing that the Commission and EU institutions can do is to help to bring healthcare systems together to exchange best practice, things that have worked, things that haven't. And of course in the area of communicable diseases we have an EU agency, the European Centre for Disease Control, who are able to help member states when they have communicable disease outbreaks that they can't manage completely themselves. And there was an example recently where Greece requested ECDC for some help with, I think it was a Legionnaire's disease outbreak. So that's one very concrete example.
Well, what we see happening at the moment in relation to healthcare in Europe is two things. We see cuts in healthcare, so that means that on the one hand, women are touched as employees, the majority of employees in healthcare systems, so that means higher unemployment rates, less quality employment, and this is one negative impact. And the second is the cut in healthcare as such, and women are using healthcare much more than men. So that means that if there are cuts, for example, in hospital stay, the needs are still there and somebody needs to take care of those needs, and this will fall back on households and primarily on women. So what we see happening is that the cuts are impacting on women as employees, on their economic independence, but also on gender equality, on the share of paid and unpaid work between women and men, and in the end may have a very negative long-term effect on gender equality as such.
Consumers expect and want healthcare system to be more responsive for their needs. Consumers want healthcare systems that are designed for them, around them, and most of all, that are designed with them.
I would say that the first thing to do is not to apply or try to develop new things, but to apply the old things that we already know. So old-fashioned things like tobacco control and road traffic safety are very important to close the existing health gaps. We can do that to a large extent with the old things. But then, of course, there will be new challenges in the future for which we will need innovation.
Well, young Gasteiners have been talking about this all week and over the last year, and out of 75 scholars from over 30 member states, the same answers are coming up over and over again, and the same solutions are coming up over and over again. Resilience seems to be about good governance. What we're saying is that we need accountability and we need transparency. We need health actors to be involved in processes like the European semester that allow us to redress the balance and the different links in between the economic and the social European Union.
So the innovation isn't only about technologies, it's about procedures, approaches and processes. Prevention is key. but the use of social media will make it much more effective.
Well, first of all, we need stakeholders, politicians, policymakers to think beyond their own mandate of 4 or 5 years and think on the long term, 10, 20 years ahead. Because we need to be willing to take risks in order to implement change. Because we need to create a momentum for change in Europe and outside of Europe as well.
You have to persuade the society that now, if they don't change, they will lose a lot. You know, it's very difficult to explain to the people who they have used to do some things in one way, that now is the time to do it with another way. But this is what we have to do, and we will do it because this is the time for change.
I think that one of the most important issues is to share our mistakes, not only our successes. And we need to create a lessons learned database or something so that we can access and see if what we are thinking of doing have been tried by someone else and what were the results, or at least to know to whom to talk, to find out what they did and what they would have not done or what they wouldn't repeat because it didn't work well. I think this way we can avoid a lot of unjustified spending and a lot of lost time and maybe sometimes a lot of lost lives.
Nine months ago, we established Intergovernmental Commission in which Minister of Health is chair of this commission, and all ministers or vice ministers are involved in this commission. And this commission solves different issues, and our decisions are legally binding for all ministers.
Many times in politics we are doing a work avoidance, and we do not really face the adaptational challenges that we should face. And I think simply to talk about these issues honestly provokes adaptational work and provokes change. So that is one of the methods that we have used in Hungary. So I never lied to anybody in local governance that yes, they need that institution that they want to defend, but I told them about the future of healthcare and I told them about the necessary changes, and so far we managed to have the agreement, and so far we managed to make the changes sustainable.
We need strong health ministers, and we need health ministers who can argue about the public good. And on the other hand, we have to assure that those health ministers can persuade their colleague ministers that health is in their portfolio too. Remember that the most important progress regarding health was made in other areas than in healthcare. So we have to reinvent this idea and to make other ministers proud to be health ministers too.
You see, unfortunately, change is incremental. However, I do believe there are big bangs, and I think this year we kind of brought together the basis of a good big bang for next year. Having said that, I think in the same way that we apply the principles of governance to our health communities, our health systems, we should apply those to ourselves. This is the principle of accountability to those of us who are in Gastein every year, to demonstrate that Gastein is making a difference and is enabling the kind of change we're looking at.